Janie has said, what should we be assessing orally or facially as osteopaths and chiropractors? Are there particular things that you would suggest we look out for in assessing a baby before making a referral to someone like yourself?
So what can be treated would be, as I say, the asymmetries. So those asymmetries definitely have impact on oral function. It used to be that people just once said, "Oh, can the baby stick their tongue out?" Oh, that's it. They're not tongue tied then. But as I say, we are looking at suck, as you just said just now. So suckling, lateralisation. But really, you need to make sure that you have trained in how to do an oral assessment rather than, just having a look. But the things that body workers can do is treat everything else. And the other thing is with infant feeding, with breastfeeding particularly, is protect supply. So find out, if you know about infant feeding, how frequently is the mum feeding? Are they expressing? Because what we don't want, and what I see quite often, is people waiting 2 weeks for an appointment, wanting to breastfeed, but in that meanwhile, not protecting their milk supply, thinking that everything's going to be fixed on the day that the tongue tie is released. So really finding out about the whole feeding journey. Okay.
Yes, and I think you also mentioned a little bit earlier on, possibly before we came on air, temporomandibular joint. Is that an area of potential concern?
Yeah, so it's what I'm seeing people sending no one's noticed. They send the baby for a tongue tie, and then that's what it is. So what I would love, anyone coming to an osteo or chiro first, that they are doing, I'm sure what you do anyway, that structural assessment, looking from the head down, what's happening, what's the alignment. And so jaw alignment, and particularly that retractor jaw, and also micronathia. So again, it's just really preparing the parent that it isn't just simply the only thing that's wrong, we're going to intervene with a pair of scissors and then everything will be fixed. It might be that a frenulotomy is going to help as well, but if there's some work that can be done prior to the oral assessment, then great. And then I would always love babies to be seen after a frenulotomy, so that any changes that take place can then be integrated.
Well, I'm not about to suggest that this is a business model, but it sounds as though there is a very valuable partnership to be built up between, I'll use body workers, but I'm thinking principally osteopaths, chiropractors, between them and people like yourself, because we could be sending babies to you saying, we've assessed this baby and we believe we've addressed this and this, but there are still feeding difficulties. Would you care to have a look? And likewise, once people have started doing that, you'll be sending babies back to those practitioners, I imagine, because you know that they're doing the right things.
Yeah, that's absolutely ideal. So I would really encourage anybody who is working with babies to go on the Association of Tongue Tie Practitioners website, find maybe your 3 nearest tongue tie practitioners. You could even possibly shadow a clinic, come and see, and have that working relationship. It'd be wonderful. I've never been given it, but I would love to have the written notes that were from the osteopath. This is what we found. This is when I'd like to see them again. And I write something that can be shown. So I always write on a card that I say, oh, you're going to see the osteopath or chiropractor next. Can you show them what I've written about the asymmetric jaw or, and ask them to work on that specifically?